This presentation is for competency number 3, Advance Human Rights in Social, Economic, and Environmental Justice. For this particular competency, we had to pick a vulnerable population and highlight a social injustice within that community, and with that, provide advocacy efforts through writing a letter to an elected official. For my population, I chose the undocumented immigrant population, specifically those who are faced with end-stage renal disease and their access or lack of access to healthcare resources. Approximately 11 million undocumented immigrants are living in the United States. Undocumented immigrants make up 27% of the uninsured population, and approximately 6,500 undocumented immigrants have end-stage renal disease. Now, the low-income population is often covered or able to get access to healthcare resources under the Affordable Care Act. However, undocumented immigrants have little to no access to healthcare and are not covered by the Affordable Care Act. There is, however, the Emergency Medicaid Treatment and Labor Act that does allow some undocumented immigrants to receive healthcare access, specifically when confronted with an emergency medical condition. And what that means is that an undocumented immigrant who faces severe medical conditions or is near mortality can then receive medical services, such as emergency dialysis. Because end-stage renal disease is not covered under the Emergency Medicaid Treatment and Labor Act, it is when an individual, specifically an undocumented individual, is in dire need of medical services, they then can receive emergency dialysis. Research shows that many undocumented individuals cannot or do not know how to navigate the healthcare system. Many get their medical care at federally qualified healthcare centers or community clinics, however, it's not specialized. And furthermore, research shows that screening and prevention are key to alleviating some of those issues. So because they don't have the access to healthcare, to appropriate and adequate healthcare, to appropriate interventions and appropriate treatment, they are kept waiting until their conditions worsen and then they can finally get medical services. Research shows that this population, as a result of no access to care for ESRD, have an increase in the following. They have longer inpatient days, they have more emergency department visits, more blood transfusions, higher mortality rates, and the cost for emergency dialysis is greater than standard dialysis. So individuals who have to wait to receive emergency dialysis, that treatment costs 4 times as much to have given them standard dialysis. Why it matters, why our advocacy efforts matter. As social workers, we are advocates for individuals who face injustices within communities. We strive to construct paths of equity and social justice and social welfare reform. And with that, we ground ourselves in ethical values that promote social justice, such as dignity and worth of a person and integrity, specifically when engaging in policy practice. Policies define and enable certain resources to be accessible to certain communities. And so we have to see how these policies impact our communities and how, as advocates, we can advocate for policy change, therefore implementing ethical and good treatment for these communities. So I chose Lieutenant Governor Jeff Duncan, who is an advocate for healthcare in Georgia, and I chose to highlight the Emergency Medicaid Treatment Act of 1986, and that allows federal Medicaid funds to provide medical services to undocumented individuals who fit within the defined emergency medical conditions. So as research has shown, treating kidney failure with emergency dialysis versus standard dialysis, it costs 4 times as much, results in higher mortality rates, and longer inpatient days. This, however, doesn't include the emotional and mental health of these patients and their families. Therefore, having highlighted that, I would like to bring awareness to this policy and having it improve by including end-stage renal disease as an emergency medical condition, therefore helping decrease the cost, helping decrease mortality rates and inpatient days and more ER visits, and the emotional and mental traumas that these families face. There are states in the United States that include end-stage renal disease as an emergency medical condition, and that includes Colorado and New York. So I strive to bring awareness to that in this state and to highlight that these communities need access to dialysis because they face very severe consequences for not being able to. And as social workers and as helping professionals and advocates for people who face certain injustices, this is a prime example of a policy reform that can create positive change and positive impacts within these communities. And these are my sources.